Hi, I'm Mike. I'm the owner of Interim Healthcare. This is our quarterly state of the company address. Each quarter, we do an address like this so that we can zoom out and give you a perspective on who we are as a company, where we've been, where we are, and what we're going toward. This is especially important to me because I want you to be able to see the connection between the hard work you do every day in service of others and how that connects to the mission that we're driving toward.
I am now switching to an AI voice. I have impaired speech, so it is difficult speaking throughout this presentation, and my speech is difficult to understand. These are my words, just not my voice. Here is our agenda for today. We will spend the next 10 minutes discussing who we are as a company, where we've been, where we are, and most importantly, where we are going. At the end of this video, you can take a quiz for a chance to win $247. Why 247? I will explain later. Let me introduce you to our leadership team. First is me. I started Interim Healthcare Salt Lake City in February 2014 after retiring from a career in the Air Force. I am a brain cancer survivor. My current role with Interim is as a visionary leader. My wife, Natalie. Natalie is an owner. She joined Interim in 2016. She is a lifelong caregiver. She cared for me throughout my brain cancer ordeal. Her current role at Interim is as a visionary leader. Alyssa Frankovich is an owner. She joined Interim in 2020. Her current role is the integrator. The integrator essentially oversees all aspects of the company to ensure the visionary's vision and company commitment is being delivered. Jamie Horrocks. Jamie joined Interim in 2021. Jamie is a registered nurse. Her current role is the operations team leader. That means Jamie oversees all aspects of service delivery to ensure our clients receive the level of care we are committed to. Jalea Yancey. Jalea joined Interim in 2021. Her current role is the human resources team leader. That means she oversees recruiting, onboarding, and maintaining compliance. So who are we? Before I go on, it is very important to clarify who I am referring to when I say we. I don't mean just the leadership team. I don't mean just the admin team. I don't mean just the caregiving team. I mean all of us. We are all here together to make the world better. What is our mission? The mission explains why our company exists, how we make a difference. Our mission? It is to protect the ability to safely live at home. What are our core values? Core values are our non-negotiable beliefs and behaviors. They define the standards we live by. If the mission is what we do, core values are how we do it. We hire and evaluate performance based on our core values. Our core values? We are dependable. We are teachable. We take initiative. We are professional. We are dependable. This means everyone who works for the company and everyone served by the company can depend on the company doing the right thing, always. We say what we mean and we do what we say. It's not about being perfect. It's about showing up, following through, and doing what we said we'd do. In home care, families aren't just trusting us with a schedule. They're trusting us with their peace of mind. When we're dependable, they can finally exhale. That's what makes us different. That's what builds trust. We are teachable. We are always looking for ways to improve. Every client has their own way of doing things, and our job isn't to make them fit into our system, it's to adapt to theirs. We bring our skills, but we mold to their routines, preferences, and personalities. The best caregivers never stop learning, because every client teaches us something new. We take the initiative. Taking the initiative means we don't wait to be told what to do. We see what needs to be done, and we do it. In home care, that could be something small, like folding a blanket or emptying the dishwasher, or something big, like noticing when a client seems off and speaking up. Initiative is what turns good care into great care. It's how we show clients and families that we truly care, because we're always one step ahead. We are professional. Being professional isn't about fancy titles or clothes. It's about showing up like it matters, because it does. Families are counting on us to bring our best every time. We're A players who bring our A game, on time, prepared, and proud of the work we do. Professionalism is how we show respect for our clients, our teammates, and ourselves. Our core values are what keep us consistent and trustworthy. They're how we make decisions when no one's watching. If we ever have to choose between what's easy and what's right, our core values tell us which way to go. Now let's turn our attention to where the company has been, the challenges we overcome, and things that led us to where we are today. Then we will talk about where we are, and finally talk about where we are going. Our past. Interim Healthcare of Salt Lake City opened February 3, 2014. We were and are licensed by the Utah Department of Health as a home care agency. We started providing facility staffing support initially as a way to keep caregivers working after the loss of their home care client. This grew and grew. In 2017, we decided to continue to provide home care services, but to shift most of our energy and focus on supporting facilities with staffing support. We saw tremendous growth. We were recognized in 2019 and 2020 as one of the 5,000 fastest-growing companies in America. At that time, our hours were split 85% staffing and only 15% to home care. We had a major challenge in 2020. At that time, most things to keep the company running were done by me and Natalie. I was diagnosed with brain cancer in June 2020. With Natalie by my side, we endured 2 spinal taps, 3 brain surgeries, 8 rounds of inpatient chemotherapy, and a month-long inpatient bone marrow transplant. In all, we were admitted to the hospital 11 times. Each time I returned home, I was in bad shape. I could not bathe or dress myself. I could not prepare food. The experience validated the incredible importance of home care and the significance of our mission. Without Natalie's amazing care, there is no way I would have survived. The Department of Veteran Affairs attributes my cancer to toxin exposure from my military deployments, so Interim is registered as a service-disabled veteran-owned small business. In 2023, we were presented with the opportunity to purchase the other Interim Healthcare franchise in Utah. This expansion made us the only Interim Healthcare franchise in Utah and gave us the ability to serve clients and facilities anywhere in the state. The majority of the care we provide is along the Wasatch Front, from Weber County to Utah County. The demand for staffing was very high during the COVID pandemic, but plummeted after the pandemic ended. We made the decision to refocus on growing home care. Staffing is transactional and impersonal, where home care is emotional and connective, and where you can see the value of the work on a personal level, so it feels very good to make this change. We have established a very ambitious goal, which is to help 10,000 people safely remain home as they age by 2035. You are helping us work toward this goal. Let's take inventory of where we are today. In the history of Interim Healthcare Utah, we have never had better administrative or caregiving staff. Our core values are our guiding light for recruiting and hiring. As of October 2025, home care revenue is up 236% over the same period in 2024. Home care is 55% of current hours, and staffing is 45%. Remember, staffing was 85% and home care was 15%. So home care is on the rise and staffing is on the decline. For growing home care business, we are registered with the VA to service military veterans. We are credentialed with an organization called Care Scout, so we can serve people with long-term care insurance policies. We are recently established with a brand new Medicare program that provides free respite care to those diagnosed with dementia. From July to September, we added 17 new home care clients. Where are we going from here? The goal is to continue growing home care to serve more families. We added 17 new clients last quarter. Our goal is to add 29 clients in October, November, and December. Because of our experience as a successful staffing agency, we have built a very efficient and effective recruiting process. I want to always be prepared for the next opportunity to serve. So unlike most home care agencies, we are always recruiting. This gives us a valuable advantage. Often when families are looking for help, it is when they have reached their limit and they need help right now. We are very good at starting care right away, often the same or next day, something almost unheard of in the industry. This ability is dependent on our caregivers being willing and able to volunteer for these situations and help. Our company will evolve to become a neurological specialty agency serving people with challenges like dementia and Parkinson's disease. We will be developing specialty programs to include specialized training, certification, and recognition for caregivers, and service plans and resources for clients. The first of these programs will focus on dementia.
Okay, fun fact about me. I learned to snowboard when I was 40 years old.
You have the chance to win $247. Why is it $247? That represents the fact that we deliver dependable care 24/7. Here's how this works. Below this video is a short 10-question quiz. All questions come from this presentation. Every score of 100% will be entered into a drawing for the prize. We will release another quiz next week, so if you want to try again to get 100%, or if you already scored 100% and you want to have 2 entries in the drawing and improve your chances of winning, you can do it then. The drawing will take place on Friday, October 31st, and the winner will be announced. Thank you for your time today. I hope you heard something here that resonated with you. We want to be more than a great company. We want to be a collective team of people all working together to make the world better. Good luck!